In this video, we'll explore how tongue position and sleep habits can affect TMD, temporomandibular joint dysfunction, and orofacial pain. Poor tongue posture and habits like mouth breathing can create or worsen orofacial pain by increasing muscle tension, restricting airflow, and misaligning the jaw. This strain affects not only the face, but the entire body. Common conditions related to TMD and poor posture include forward head posture, facial asymmetry, a poor facial profile from mouth breathing, misalignments in the shoulders, pelvis, knees, and spine, a tied tongue, and habitual mouth breathing. These postural and muscular imbalances contribute to discomfort and dysfunction. Treatment focuses on posture correction, palatal expanders, and myofunctional therapy to address the root causes and relieve pain. Tongue posture plays a crucial role in maintaining an open and healthy airway. When the tongue rests low in the mouth, it can restrict airflow, leading to sleep disturbances such as snoring or even sleep apnea. This disruption in breathing affects the overall alignment of the jaw, contributing to TMD development and progression. Poor tongue posture during sleep not only worsens TMD, but can also increase muscle tension in the face and neck, leading to pain and discomfort. Maintaining proper tongue posture is key to supporting healthy airflow and preventing TMD-related issues. The tongue should ideally rest on the roof of the mouth, just behind the upper front teeth. Poor tongue posture, where the tongue rests too low in the mouth, can lead to several issues, including jaw misalignment, overuse of the jaw muscles, teeth grinding or bruxism, and TMJ inflammation. On the other hand, correct tongue posture supports the natural alignment of the skull and jaw. If the tongue rests too low, it can lead to forward head posture, causing neck strain and poor spinal alignment, further exacerbating TMD symptoms. This is because a recessed or improperly supported maxilla forces the head forward to maintain airway patency. The head shifts forward to open the airway, causing an anterior shift of the cervical spine. This forward head posture places excessive strain on the neck muscles, sternocleidomastoid, suboccipitals, and trapezius, leading to chronic pain and poor spinal alignment. With a proper tongue posture, the tongue's pressure ensures that the maxilla remains broad, supporting the nasal airway and maintaining a well-aligned bite. Occlusion. If the tongue does not provide this support, the maxilla may collapse inward, leading to a high-arched palate and narrow upper jaw, restricting the nasal airway and forcing the lower jaw, mandible, into a more retruded position. Mouth breathing leads to hypertrophy of the adenoids and tonsils, further obstructing airflow. Chronic mouth breathing changes craniofacial development, often resulting in a long face syndrome, smaller nasal passages, and an increased risk of obstructive sleep apnea, OSA. The entire myofascial system is interconnected, meaning that poor tongue posture doesn't just affect the jaw, but also the hyoid bone position, which influences swallowing and breathing. Cervical spine alignment, which impacts muscle tension from the base of the skull down to the thoracic spine. Pelvic alignment, since forward head posture can lead to compensatory changes in the lumbar and pelvic region, affecting gait and posture. The aponeurosis is a key connective tissue structure that distributes muscular forces throughout the body. The gallia aponeurotica, a fibrous tissue layer that connects the forehead, scalp, and occipital muscles, is directly affected by poor tongue posture. If the tongue rests too low, the imbalance in jaw and neck muscles can tighten the gallia aponeurotica, leading to increased tension in the suboccipital muscles, worsening headaches, restricted movement in the cervical spine, affecting posture, increased strain on the temporalis muscle, contributing to TMJ dysfunction. By maintaining proper tongue posture, tension is more evenly distributed through the aponeurotic system, allowing for a harmonized relationship between the craniofacial structures and the cervical spine. The forward head posture also impacts the distance between the back of the tongue and the posterior pharyngeal wall. The contact of these two structures creates the needed environment to move the bolus into the esophagus as well as tilt the epiglottis and protect the airway. With a forward head posture, the distance between the tongue base and posterior wall is increased. In turn, tongue pressure may be reduced, limiting the patient's ability to move the bolus into the oropharynx, pharynx, and esophagus. This can lead to dysphagia. Poor tongue posture affects jaw development, leading to a narrow palate, crowded teeth, and misalignment. It contributes to mouth breathing, forward head posture, overbite, underbite, open bite, and crossbite. This can cause TMJ pain, bruxism, speech issues, sleep apnea, and sinus problems. Respiratory consequences of poor posture. Slumped and kyphotic posture increases intra-abdominal pressure, restricting diaphragm movement. Reduced lung capacity weakens coughing, compromising the ability to expel aspirated food or liquid. Spinal misalignment and pelvic tilt. Increased thoracic kyphosis, hunchback posture, and excessive lumbar lordosis, hyperarched lower back, affect the hips, causing anterior or posterior pelvic tilt and uneven weight distribution. Effects on the hips and lower body pelvic tilt alters hip rotation and leg positioning, leading to hip pain, knee misalignment, and foot arch collapse over time. Bad tongue posture affects your body. Tongue and head. Tongue resting low pushes your head forward. Head and shoulders. Forward head makes shoulders round. Spine and pelvis. A misaligned spine tilts the pelvis. Hips and legs. Pelvic tilt leads to pain and misalignment. How to fix it? Rest tongue on the roof of the mouth. Breathe through your nose, lips closed. Strengthen neck and back. Stretch chest. Poor posture and its impact on nerves and circulation. Blood flow and pressure, slouching or forward head posture can impair circulation in the neck and head, causing vascular congestion and altered blood flow. Neck muscle tightness, especially in the suboccipital region, may hinder venous drainage, creating a sensation of increased head pressure. Neck and jaw tension on nerve sensitivity. Poor posture tightens the neck, jaw, and facial muscles, potentially irritating trigeminal nerve branches. Cervical misalignment, particularly at C1-C2, atlas axis, can heighten nerve sensitivity and intensify pain perception. Intracranial pressure, ICP, and posture. Although posture doesn't shift the TCA, prolonged forward head posture or awkward lying positions may disrupt cerebrospinal fluid, CSF dynamics, slightly increasing intracranial pressure and potentially worsening TN symptoms. The oral sling and swallowing mechanics. Facial muscles form a muscular sling that maintains positive pressure during swallowing. Forward head posture weakens this sling, causing decreased lip closure, leading to drooling and food pocketing. Weakened bolus propulsion from the mouth to the throat. Increased tongue-base distance from the posterior pharyngeal wall, reducing swallowing efficiency. What is the optimal position? Optimal tongue position is when the tongue rests gently against the roof of the mouth, just behind the upper front teeth. Poor tongue posture can have significant effects on your jaw and overall health. Proper tongue posture is essential for overall health, breathing, and even facial structure. When the tongue rests too low, it can contribute to jaw misalignment, teeth clenching, and poor posture. Here's how to improve it. Find the correct resting position. Keep your mouth closed and your teeth slightly apart. Gently place your tongue on the roof of your mouth, pressing lightly against the palate. Make sure it doesn't block your airway. Breathing should feel natural. Master proper swallowing. When swallowing, your tongue should press up against the roof of your mouth. It should create a wave-like motion, first engaging the palate, then applying pressure toward the back teeth. Train your breathing and muscles. Always keep your lips sealed and breathe through your nose. Avoid tongue thrusting by practicing mindful swallowing techniques. Consider myofunctional therapy to strengthen tongue and facial muscles, which can improve posture and relieve tension. Making these small adjustments can have a big impact, not just on your oral health, but on your overall well-being. Start today, and over time, proper tongue posture will become second nature. Myofunctional therapy trains your tongue to stay in place, while orthodontics expand the palate and align your bite. Night splints reduce teeth grinding and jaw strain, and nasal breathing training improves airway function for better sleep. By using the right tools and practicing proper posture, you can improve your health and comfort over time.